The Republican prescription for Obamacare is being dissected. The Congressional Budget Office announced today the Better Care Reconciliation Act would cut federal spending by more than $320 billion, but 22 million Americans would be uninsured. Bo Evans tells us what the changes would mean for North Dakotans.
Opposition to the Senate Republican health care plan is already mounting.
Well, none of this adds up, and I think once it's parsed and once people have a chance to take a look at it, it's only going to get more difficult.
Democratic Senator Heidi Heitkamp, along with other members of her party and a handful of GOP senators, are expressing doubts about the latest attempt to replace Obamacare. Insurance Commissioner John Gottfried says the idea behind the new plan is to incentivize younger people to buy insurance.
It's kind of front-loaded, so there's a larger tax credit for younger folks, and as you get older and potentially earn more income, that subsidy will shrink a little bit.
But the tax credits for many people will be reduced. There are many differences between the Affordable Care Act and the Better Care Reconciliation Act. But one of the ways it will affect people is the difference they receive in tax credits to pay for their health insurance. According to the Kaiser Family Foundation, a 40-year-old in Burleigh County who makes $30,000 a year under the ACA would receive a $2,200 tax credit. Under the BCRA, that would go down to $1,760. On the bronze plan, you would pay about $1,430 under the ACA and $1,870 under the BRCA. Or the cost of your insurance would go up about $440 a year. The current Republican proposal isn't set in stone, and lawmakers have already made some changes. Heitkamp says there are issues with Obamacare that members of both parties agree on.
Younger, healthy families are disadvantaged on the exchanges, and you've got to fix that.
Republican leaders hope to vote on the bill as soon as this week.
According to the CBO, by 2026, an estimated 49 million people would be uninsured. That's compared with 28 million who would lack insurance that year under current